I woke up just like every other morning, went and got a cup of coffee, came back to the bedroom to start getting dressed, and all of a sudden my chest started hurting.
It wasn't just the chest pain that Monday morning. When Patrick Lynch started complaining of tingling in his left arm and a headache, his wife knew it was time for a trip to the emergency room at Christus Santa Rosa Hospital, New Braunfels.
Interestingly, that day, there was also another person having a heart attack. So we were able to handle both Mr. Lynch as well as this other person in extremely expedient time, get his vessels opened, and actually save Mr. Lynch from having bypass surgery.
For heart attack patients, time is of the essence, and the American Heart Association sets standards for what's known as door-to-balloon times. It's a measurement of how long it takes for a heart attack patient to receive immediate relief to any blockages in the heart from the moment the patient steps through the ER door. Christus Santa Rosa Hospital, New Braunfels not only meets the standard for door-to-balloon times,
Hey guys.
It beats it.
Getting blood flow back to that vessel and back to that muscle within 90 minutes is the goal. Here at Christus, our average door-to-balloon is 42 minutes. Our fastest door-to-balloon here is less than 12 minutes.
So we're very fortunate for the standard and the quality that Christus has brought to New Braunfels.
Patrick's ER visit led to immediate surgery, where several stents were inserted to open up his arteries, and he was placed in an induced coma. So great was the concern for his health, he was given last rites by a visiting priest. But the quick intervention by Christus's nationally accredited cardiac team in his hometown of New Braunfels made all the difference.
If I had a heart attack a few years ago, I have to go to San Antonio or Austin. And they say I don't make it if I had to travel that distance.
Christus Santa Rosa Hospital New Braunfels Cardiovascular Center offers the latest state-of-the-art technology to perform everything from advanced diagnostic procedures to complex interventional procedures and open heart surgery. The quality of care is reflected in its certification as a chest pain center from the Society of Cardiovascular Patient Care and recognition by the American Heart Association with its Mission Lifeline Bronze Receiving Quality Achievement Award.
It's a little challenging?
Yes.
Good.
And as Patrick found out, Christus Santa Rosa's comprehensive cardiac care continues well past the initial evaluation and surgery. His rehabilitation started within weeks of being released from the hospital.
Glory days.
When they come here, the transition's smooth. We have all of their information. They know our familiar faces, and they already feel comfortable. We've built that level of trust with them. All right. We're going to go ahead and increase you just a little bit. Our goal is to strengthen their heart. Most of the time it's to build stamina and endurance so that they can return to their daily activities. We focus mainly on cardiovascular exercises. Can you feel the difference?
Yeah, that's better.
For Patrick, light weightlifting and cardiac rehab made all the difference in feeling better.
From that period forward, every week it seemed like they pushed me a little bit harder, which I really appreciated because I felt very weak and almost inadequate until I started working out with them.
Like the hospital's cardiac team, Christus Cardiac Rehab is nationally accredited for its specially trained therapists and programs. Those high standards are reflected in the care for patients like Patrick.
Their level was just like the hospital. They monitored me every time I went in there. They asked pertinent questions. They cared about their service and wanted to know how they had done as well. It's good, it's challenging.
The leg's doing all right though?
Yes.
They're gonna hold it. I enjoy watching the patients progress. It is such a blessing to watch them from day one sitting in a hospital bed to roughly 3-4 months later graduating from our outpatient cardiac rehab side.
Now, Patrick is back enjoying life and taking up old hobbies like golf. He says he owes his life to the outstanding physicians, nurses, therapists, and associates that make up Christus Santa Rosa.
They went way beyond what I could ever have imagined for service and just did a phenomenal job. Their professionalism, their caring was just something that I'll never forget.
For more information about our cardiac services, visit christusantarosa.org/heart.